The patient presented with corneal tear and traumatic cataract with ruptured anterior capsule. So in this patient we performed primary corneal tear repair. You can see the two 10-0 nylon sutures in the cornea, and after this primary corneal tear repair, then when the eye becomes quiet, we will perform the traumatic cataract surgery. So in this patient we devised a two steps procedure. In first step, just close the wound, close the eye. When the inflammation gets settled, then do secondary intervention with lens meta respiration plus foldable IOLs insertion plus minus anterior vitrectomy if there is any PCR. And the other technique is to do both cataract surgery and tear repair in a single go.